Good afternoon, everyone, and welcome to this week's Friday Forum. My name is Tafana Irvin, and I serve as the Executive Director for the Foundation for Tacoma Students. As many of you know, the Foundation seeks to build and strengthen the Graduate Tacoma community movement that helps every child achieve success from cradle to college and career. As part of our organization's response to COVID-19, Friday Forums were launched to provide relevant and locally focused information and resources to our community partners and our families. Over the past several weeks, we've covered a number of topics, including the state of Tacoma Public Schools, teaching and mentoring from a distance, and how COVID-19 has impacted the childcare industry in Pierce County. Today, we consider something that affects us all. And to be frank, for many of us, it's already a topic that is wrought with stress and anxiety. It's our economy and the ability for Tacoma residents, institutions, nonprofits, and businesses to withstand what is on the horizon. We'll begin with part one of a two-part topic, and we will explore private and public funding options during COVID-19. And we will learn about lessons during the Great Recessions and how those lessons can inform our actions now and into our future. That said, it's my pleasure to introduce to you all three individuals, colleagues and friends who bring a unique perspective on the future of our economy and the role of philanthropy during this time. With us today, we have John Burbank, Executive Director with the Economic Opportunity Institute. We also have Dona Ponepinto, President and CEO of the United Way of Pierce County, and also Erika Tucci, Senior Program Officer with the Ben B. Cheney Foundation. With that, we'll begin with John Burbank's presentation, and I'll have him take it from here. John?
Thank you very much. I'm hoping you can all hear me. Thank you, Tafana. That was a great introduction, and I think that the work that you do is most important in terms of enabling economic security and economic opportunity and educational opportunity, particularly for working class, low income people in Pierce County. And what we're seeing right now is a sort of existentialist threat to the ability to enable this sort of educational opportunity for the people of our state. I'm going to talk about where we are in terms of state revenues and state services, because those are under profound distress right now, and the current narrative from the Seattle Times editorial is the most responsible thing to do is for the legislature to make huge cuts in state funding and state services. And what I will be talking about is how that may seem like the most responsible thing, but it actually is the most irresponsible thing to do for the people of our state. And it's actually the easiest thing to do for the legislature to consider. And there is a different response which we need to be moving forward, which is we need to build a progressive and a robust public revenue system so that we can sustain public services. So I'm going to start with this PowerPoint, which I hope I get the right one here. Yeah, I think this is it. Okay, I hope everyone can see that. Let me, okay, so here we go. So this is a presentation about our economic weaknesses as a state, as a county, as a country, revealed by the pandemic and what we can do about it. I'm gonna move on here. And I think it's important to emphasize that we're the least prepared of any wealthy country to take the body blows of a pandemic like this. And the reason is that we don't have universal health coverage. We don't have universal paid leave standards. We don't have strong public support for childcare. And we don't have a strong regulatory and social safety net. And so that makes all of us susceptible to a lot of economic insecurity. And I'm not just talking about very poor people, I'm talking about middle-class people, working-class people, all of us who are residents of this state of Washington. And one of the reasons we don't have those things is because of the policy choices that legislators and congresspeople and presidents and governors have made over the past 40 years that have actually perpetuated and doubled down on income inequality in our country and our state, that have given tax breaks for the wealthy and at the same time disinvested in people and in public infrastructure, that have sort of put together this narrative of distrust of government. And I'm not blaming one party or the other. I think both parties have had participants in trying to move this narrative along, that we should distrust government. And also the results of all this economic and sort of social narrative is to double down on institutional racism, anti-immigrant policies, and double down on our cultural and institutional and historical and in fact constitutional history of racism in our state and in our country. Now, on the other hand, we have actually in our state made really good strides in terms of workplace standards. So we have the best minimum wage, statewide minimum wage in the state, in the country. We have the best paid sick and safe leave in the country. We have pretty much the best paid family medical leave provisions in the country. And we have the best overtime protections. So it gives workers a certain, what should I say, a bench or a cushion of security, which workers in other states don't have, and which makes workers in other states much more vulnerable to the ups and downs of the economy, and particularly to this pandemic / depression. So I want to go on to the next thing here, but we still have this problem, right? That this rising in income inequality leaves many people behind. So you can see here, this is for Washington State. Between 1945 and 1973, the growth of income was pretty much even-steven between the top 1% and the bottom 99%. That is, they each experienced a 46% increase in income. But look what happened between 1973 and 2007. The income of the top 1% grew by 272%, and the income of everyone else grew by 34%. And then, since the Great Recession, we can see that the income of the top 1% it grew by 53% to 2015, and everyone else by 13%. And keep in mind, everyone else, it means that essentially everyone else with incomes as much as $750,000 a year. So this is a generous understanding of everyone else. And at the same time, we can see this has resulted in incredible racial inequality in terms of wealth. So white households have wealth in 2014 of 132,000, Black households of 9,000. This is a fairly damning indication of economic policy in the United States. And in our state, you can see that the people who are most at risk are single moms and young children. So almost 40%, or 2 out of 5 households that are single mom households are living in poverty. Okay, so why is this? Well, one of the reasons is that we have a tax system that doubles down on the economic inequalities that are produced by the private market, with a tax system that essentially penalizes low-income people and rewards high-income people. If you look at the share of income that's devoted to state and local taxes in Washington, for the bottom 20%, 18% of people's income goes to state and local taxes. And for the top 1%, 3% of income goes to state and local taxes, which basically means 18%. It means basically that someone is working until the middle of March to pay their taxes if they're in the bottom 20%. And if you're in the top 1%, you're working until the second week of January to pay your state and local taxes. So if you can sort of equate this to time, you can see how this really penalizes people in terms of their actual lives, their amount of time that they spend in terms of working to and paying taxes. Now, one of the results of that is that one of the reasons is because we have this overdependence on the sales tax and on the B&O tax in particular, and also on the property tax. But the sales tax has been only really for the purchase of goods and not services. So as a result, it's heavily tilted towards working class and low income people. For example, if you want to do your taxes, you can go to Costco and buy one of those TurboTax packages, and you pay sales tax on that. But if you go to an accountant to have the accountant do your taxes, you don't pay any sales tax on that work. So that's just one example of how the fact that we're not taxing services but only goods is, first of all, tilts taxes more and more towards lower income people. And secondly, as our economy shifts from goods to services, it decreases state revenue significantly. And you can see this here is that the state budget is declining relative to income. It was 6.6% back in 1991, and now it's 5.2%. And that's a significant, think of that, that's 1.4%. Doesn't sound like a lot. It's about 25% drop. And then, so here's a little picture. I don't want to get too fancy on this stuff, but if you look at the yellow line, the yellow line is the drop in per capita taxable sales as a percent of income in Washington State. So you can see that back in 1970, it's about 60% of taxable sales were a percent of income in 1970. And now we're down to about 35%. So while you can see the lighter blue bars going up, that's personal income, our sales tax revenue is not going up much at all. In fact, right now we're, in terms of total revenue per capita, we are where we were over 12 years ago. So that's no way to build an economy that's appropriately funding higher education, et cetera, and early childhood education and social services. And one of the reasons we're in this hole right now is that it takes so long with our tax system to recover from recessions. So for example, if you look just down in the 2007, 2009 recession, our per capita income recovered in 5 years, but our per capita taxable sales did not recover for 11 years. And that means that we are always trying to make up to where we were rather than advance. And this is a little graph that shows us, and it's a little bit confusing. I apologize for that. But I think the important thing is the light brown and light green. So the light brown is K-12 funding. And as you can see, it went up significantly. And that's really because the state took over spending for K-12 education that was previously covered by school districts. So while from the state perspective, it looks like a big jump, from the overall perspective of total funding, it's not that big of a jump at all. But what's discouraging is, as you know, that K-12 education is a constitutionally mandated service of the state. Everything else is not really. And so look at this green line where you can see that our spending per capita is still much less, like thousands of dollars less than what it was back in 2006, 2007, and 2008. So when we have a tax system like this, which is completely dependent upon sales tax and B&O taxes, then you're going to have be very, very vulnerable, first of all, to recessions and a depression in consumption. And secondly, it's going to take you a long time to come back. And this gives you an idea of the results of that. So the top is, this is social and health services funding per case. And as you can see, this line is the amount of spending per capita. And we've essentially dropped by $2,000 per capita at the same time that the level as need has gone up significantly. And to give you an idea, because of our the reaction of the back in 2009 and 2010 and 2011, the reaction of the legislature and of Governor Gregoire was not to find new sources of revenue, but just to cut public services. And that is actually what they did. It was irresponsible, and it was much easier to do than looking for new sources of revenue. But look what happened. 64,000 people lost health coverage. 155,000 people are on the waiting list. 180,000 people lost dental, vision, podiatry, and other services through Medicaid. 120,000 faced reduced mental health services. 50,000 low-income seniors lost assistance to cover prescription drugs. 40,000 seniors and people with disabilities had cuts in home health care. 46,000 women lost family planning services. 23 million was cut out of maternity support. And there was a 45% reduction in per capita funding for alcohol and substance use. And those are just social services. If we want to talk about parks, for example, parks funding went down by 90%. And that's why you see when you go to state parks now, you have to pay an entry fee. And some of the parks were closed. And part of this is just a reduction of what is seen as a responsibility of the state for all the people of our state. There were 23,000 people who lost TANF in 2011, 20,000 who couldn't work due to disability, lost income support. And this is important for education in Tacoma. UW tuition increased 75%. There are 145,000 students who did not get the state need grant, even though they were eligible for it. K-12 class sizes were increased. Prisons to parks were cut. And thousands of school employees and other public servants lost their jobs. And the thing is, government funding is actually job creation. So when this happens, this is really bad for the economy. So where we are now? Well, we're in the pandemic. And you can see this. Everyone knows this. Everyone knows someone who's lost their job. And just on May 2nd, there were 109,000 more UI claims. I mean, it's sort of unprecedented. I think the last week in February, there was something like 3,000 or 2,000 claims, and there was a little jump on March 7th to 6,500. But look at this. This is just phenomenal. And who's getting hit? Well, this is interesting, right? And really sort of discouraging. The accommodation and food industry, food service industry is getting hit the most. And these are the people who are, in general, the most poorly paid people. And those are the ones who are getting laid off and losing their jobs. And with no necessary hope that those jobs are coming back. I mean, we're having a profound reorientation of our economy. And what's going to be hit are particularly hotels and restaurants and convention centers and things like that. And if you look, here's a sampling of occupations that are applying for UI, and you can see childcare workers and preschool teachers. Over 10,000 people have applied for unemployment compensation. So that's about approximately 33% of the total workforce in childcare and early learning. 33%, so a third. My understanding, there have been about, as of a week ago, 1,600 childcare and family home providers had shut down. They together had about 70,000 slots for kids in our state. So what happens after you lose a job? Because we have a health coverage that's based upon employment, you lose your insurance. And this is really terrible. I mean, look at that, 892,000 people who no longer are insured in our state. That's more than 11% of our total population. And then you can say, well, where'd this come from? Well, it's pretty obvious. Look at this. 52% of those who lost their insurance, lost their jobs, also lost their insurance. Now, let's look at some good news. As I said at the beginning, we do have some excellent policies for workers. So we have paid sick and safe leave, and we have paid family medical leave, which can be up to 18 weeks of coverage for paid family medical leave, and it applies to everyone. It doesn't matter how little your income is or how large it matters. What matters is how many hours that you've worked in the previous year. So this is about a third time in order to qualify for paid family medical leave. That's something that most states don't have, but we're lucky that we have this in our state. And it's not luck. It's a policy decision that was prompted by the policy development and sort of the catalytic activity of, frankly, my organization, the Economic Opportunity Institute, building a coalition, the Working Family Coalition, which lobbied for this and finally persuaded the legislature after 20 years to put this into place. Luckily, it was put into place before COVID-19 because now we have that insurance policy. So what about undocumented immigrants in this crisis? So, we know that undocumented immigrants are doing a lot of the basic essential work, and that's nothing new. That's been there all along. It's just that it's sort of been hidden. Now it's not so hidden. If you're an undocumented immigrant and you're under the age of 19, then you qualify for Apple Health. But once you turn 19, you don't qualify for that. In fact, you don't qualify for any of the federal leave passages. In fact, if you are a citizen but you're married to an immigrant, an undocumented immigrant, then you also do not qualify for a lot of the federal relief packages. So this is a reason why we need at the state level to step up to provide relief, health coverage, and frankly, personal protective equipment for undocumented immigrants who are doing all the essential work. And many of our friends are pressing for what's called the Washington Worker Relief Fund. So given all that, given that we're going to see a revenue loss of about at least $7.5 billion over the next 3 fiscal years, which is about more than 10% of the state budget. What can we do? I said at the beginning that the easy thing to do would be to just cut services. But in fact, we need more services. We need to cover the state purchases of PPE, and we need to cover the state expenses for testing and tracing. We need to cover healthcare for undocumented workers. We need to figure out how we can get to universal health coverage. We need to ensure that that we rebuild the early learning system and that we pay the early learning workers a decent wage. Right now, their wage is about $14.20 an hour for the average wage. So we actually need an increase in public services, not a decrease. So how do we do that? So this is a sample of what we could do. And we'll start with the actual tax reductions, which you're probably wondering, why is he talking about tax reductions when we need to have more public revenue? Well, the reason is that we have such a profoundly regressive tax system that penalizes low income and people and small businesses. We got to take a look at that. So if we were to actually reduce property sales and B&O taxes by 25%, we would lose about $4.5 billion in a year. So how do we make that up? So if you go down to the green bar, you can see that we can make it up by going to looking at new taxes. And the thing is we are lucky in our state. We have this awful tax system, but we have significant, amazing wealth in our state. And it's time for us to figure out a system that the people who are enjoying their wealth contribute to the public good and welfare. We could put in place a millionaire tax. That is an income tax on income above $1 million. And that would raise $4.2 billion in revenue in a year. We could also put in place this CEO tax, or what is an executive compensation tax, and that could raise $853 million. And not to get too fancy about this, but the tax would start above the Social Security FICA ceiling. So above that, $137,700. The corporations make no contributions for Social Security taxes or for paid family medical leave. And so they get a 6.35% windfall, which is why we could start taxation at that level. We could do a better estate tax that would bring in an easy 16 million, an inheritance tax, and a billionaire tax. Now, this is the one that's really interesting. It's interesting because we have in our state 3 of the 10 wealthiest people living in the world: Jeff Bezos, Bill Gates Sr., and Steve Ballmer. And if we were, and yet they pay very little in taxes, and that's just not right. So we could put in place what's called a tax on intangible property. We all pay property tax. That's on real property. But we don't pay any tax on stocks and bonds and savings accounts. And that makes sense for most of us. But for these billionaires, they literally have $100 billion, some of them, in those accounts. In fact, Jeff Bezos' wealth has gone up by $25 billion during the pandemic. So it makes sense to have a property tax on that wealth. That would be an intangible property tax in excess of $1 billion, and that would bring in $4.4 billion. So the total revenue could be easily $10 billion a year. The anticipated drop in the annual revenue because of COVID-19, I put it at $2 billion. If we did all those decreases in the regressive taxes, we would still have $3.5 billion left. So there's a way to do this. What is lacking is the political will. And yet, if we're going to make a new world from the ashes of COVID, we have to figure out how we can rebuild childcare, how we can get to universal health coverage, how we can have a higher education system which is indeed affordable and accessible for all, how we can include immigrants and families, and how we can rebuild our economy to promote equity and respect for workers and for small businesses, and resiliency in building a future for all of us. Thank you very much. I'm happy to take questions.
Thank you. That was a very robust overview that has many questions just in my mind popping up. But we're going to move us right along and hold off on any questions so that we can ensure Erika and Donna have an opportunity to add a little bit of context as well to local. Erika, why don't you kick us off a bit too around how the philanthropic community has structured itself around the COVID crisis?
Sure. Thanks, Stefana, and good afternoon, everybody. I'm Erika Tucci with the Ben B. Cheney Foundation, and I'm also part of the Pierce County Connected Response, which is what we're here to talk to you about today. There's really two pieces of the Pierce County Connected Response. I look at it as the information side and the funding side, and Donna's going to talk a lot about the funding side. So the information side of the house really sprung from Greater Tacoma Community Foundation and United Way acting quickly in the early parts of March, which seem like forever ago now, to build a pooled fund where they were able to bring funders in the community together really quickly, pool a fund, and then we all kind of sat around and thought, well, shoot, how do we get the best information from the providers on the ground as to where they need our help most, how we can be most helpful to their work in a time where they were working 12, 14-hour days, managing incredible load of new clients, dramatic decreases in funding. That was fundraising season. We lost a lot of fundraisers. So how could we best, as a group, get our hands around this community, share information, share resources, and bring the biggest lift? So I'll share my screen and show you what we came up with. So the response was really formed similar to how you would see government structure themselves into an incident command structure. This is something you'd see FEMA use in times of crisis. And so it's a way to really get information up the chain quickly and out to the community, or out in this case, particularly to the funders and the people making the decisions. So phase one, this is the structure we started with. We're about ready to launch into phase two. So stay tuned for that if you're reading the daily reports. But we organized into key sections, which sectors of the economy and the community and the nonprofit sector were really emerging as the priority areas. You'll see those on the left-hand side, the operations side of the house. And that was food, childcare, and particularly childcare for first responders in those early months, and then the housing and shelter situation. On the right side of your screen, you'll see the logistics side. So that's the inputs. That's where you'll find the funding committee, the faith community. We engaged the faith community to understand where they wanted to plug in and where they could bring resources to help. And then the volunteers as well. How do we bring volunteers in to support what the nonprofits needed in that moment? So the pod leads in phase one were not necessarily our subject matter experts. The subject matter experts were too busy doing the service provision on the ground. But who these folks were folks that had some sort of situational awareness to that particular subject and could just plug into existing conversations. We already had duplication of meetings and phone calls and things like that. So not only was this structure allowing us to glean information out of the community really quickly, but it was also allowing us the opportunity to take some administrative pressure off of the providers and give them one place to go for information so they didn't have to make 6 different phone calls. So from this structure, where we were getting the information in, we started publishing a daily report, the Pierce County Connected Daily. Hopefully a lot of you are subscribed to that. And you'll see the daily report organized into those same sections, and you'll see bullet points in each of those sections every day. So it's situational awareness, it's emerging trends, it's things that we're hearing from the providers, it's needs sometimes. And from that structure, we've had some really cool big community shifts happen already. So large shout out to 211 and the United Way. They've stepped in and been a huge help managing all of the volunteer needs in the community. The State Emergency Operations Center and the County Emergency Operations Center have linked to them and are grateful for that one resource. 211 also partnered up with the Behavioral Health Pod that you didn't see on that structure, but they're part of phase 2 to create a new one-stop shop for behavioral health needs, because we know that's going to be a huge emerging trend here in the community. So while this effort was really focused at the initial points on getting good information to the funders, it's been beneficial for the whole community. And as we shift into this phase 2, I think it's going to help us really understand how all the systems and segments, pieces and parts can work together in new ways to bring all the resources to bear to address this situation.
Thank you, and incredible work. There's always this question about what's in the secret sauce of Tacoma Pierce County, and it's just what you described, that rapid response and ability to get to the action without overwhelming and burdening those who are already so deeply into it. Thank you for sharing that. Donna, I wonder if you can kind of round us out a bit about what the Pierce County Connected Fund is and the areas that have been funded and or will be funded.
Good afternoon, everyone. Sorry about that. Dona Ponepinto, United Way of Pierce County. And yes, this has been just an amazing collaboration between not only United Way and the Greater Tacoma Community Foundation, but all of the other funders, especially the family foundations in Pierce County and throughout Washington. So the Pierce County Connected, the fund, you know, as Erika mentioned, falls under the bigger structure, and United Way and the Greater Tacoma Community Foundation came together to launch this, what we call this aligned philanthropy response to all of these emerging and very critical needs that were coming out of the COVID-19. And so what we wanted to do is, you know, out of the starting gate, really support those organizations that were providing services that could address the most critical needs, those things that were really disrupting the human services in the county to the most vulnerable populations. In those areas, we started off focusing on 3 different buckets. Food. We know food insecurity is huge. I mean, I do some volunteering with St. Leo's, and every Friday I'm over at Jason Lee giving out food, the weekend backpacks. And more families are needing that and asking for that week to week. So you've got food, you've got the you've got food, you've got housing and shelter. The homeless issue, as we know, certainly has been exacerbated because of COVID-19 and the measures that those organizations need to take in order to make sure that their clients as well as the staff are safe. And then childcare, which John mentioned, you know, the impact of childcare, which is going to continue to be an issue. So with the fund itself, what I felt was really unique about it, and that was not typical of a grant process, of normal grant processes, is that we wanted to get these dollars out right away. And so we have 4 phases to the process. The first 2 phases were getting dollars out for those most immediate needs. We've raised about $7 million in the fund at this point. The first phase, which we did in about a week, which was fantastic. We got out $1 million. Then the second phase, we distributed $2 million. And again, most of those dollars are going towards shelter, food, the most critical things that organizations need to meet the growing needs of their clients. The third phase is going to focus on emerging needs, and we're going to put $2 million towards that phase, and it's going to starting now through September. And with emerging needs, really what we're looking at is allowing organizations to be creative and adaptive. So what might have been emerging or what might have been urgent a month ago, what are the things that they're seeing now that will help their organization move forward? So the emerging piece of this, what we're going to slow down a bit because those are going to evolve, right? Every day things are changing. And so we want to make sure that we're paying attention, and the information that Erika's gathering from the different groups and pulling together that information on a daily basis helps to inform the work that the fund is doing. So it's, it has been one of those processes where we have paid attention as well to equity is very key. So racial, ethnic equity, but also looking at geography, making sure that we're paying attention to the rural areas within our county. And we wanted this to be a simple process. We know as funders, sometimes we can make our processes very complicated. The application is basically one question, with some checkoff boxes so we can get a sense of, where people are serving those most vulnerable, and that it's transparent. We have been very transparent on what organizations are receiving so that people can see we are not just giving, the larger organizations the bigger pots of money, but that it's being spread out, and that we're paying attention to the most vulnerable populations, those that are experiencing food insecurity or homelessness, the frontline workers as well, and immigrants and the people experiencing domestic violence. So we, after the third phase, and hopefully we'll have some, hopefully we'll have some additional resources, we're going to go into what we call a rebuilding phase. And so we'll see what happens after that phase, and more to come. But I think what we've learned is that we can be nimble as a funding community, that we can bring together our resources and leverage those resources to get them back out into the community as quickly as possible to meet those most urgent needs.
Thank you, Donna, and thank you, everyone. Many of you have either heard me say or you have read in some of our publications that in a matter of weeks, systems and sectors have had to rethink the way in which they do business. And Donna just underscored that that has happened not only in the philanthropic community, but is something that can be done. And it's one that we should be leading with, one that we are thinking about and holding as we go into our rebuild phase, because the way in which COVID has shook all of our lives, both professionally and personally, has got to take stock in the way that we think about the future, particularly for our most vulnerable and or marginalized. So I want to thank you all for providing us with just an overview and some depth to what's happening, particularly here locally. And for those of you who are listening in, to see that there is some real creative and innovative solutions that are being considered and explored as we are currently faced with this pandemic. That said, I'd like to open it up to anyone who is live streaming with us to do any questions that you might have. But first, we'll start with those that came in earlier this week. And so I want to ask you, Erika, how can we forge private and government partnerships in a time like this?
Yeah, it's a great question, because I think in what I'll call a blue sky day, a lot of us were operating in independent silos. The funders were here, the providers were here, the government sector was here, and we didn't really share information or thoughts about what we could do to make a community thrive. And so that incident command structure has really helped us build those centers of excellence and collective knowledge across all of us. And even just organizing into the incident command structure bought us in the nonprofit sector some credibility with the government sector, because we could speak their language. And so when we showed up in those early weeks speaking their language, we were able to sit at their table in a way that we haven't been before. So we've seen some really creative things happen. We've seen some, when you gather up everybody that maybe is on a specific topic, let's say the sheltering issue, and maybe they've not had the opportunity to be together before and present ideas forward to the government sector as a collective. They're being heard in different ways. And so I'm really optimistic. The government sectors, they've been making funds, has tapped into the PCCR and some of the pods to ask for expertise. And that's not always been the case. And so I think Pierce County is developing something really powerful going forward.
I couldn't agree more. John, Donna, in the wake of COVID, what are 2 key legislative issues that we should all be thinking about and considering, but really that need to be addressed and are fixed?
So yeah, and John could probably add to this because he spoke to a lot about childcare. And, you know, the whole idea of increased access and affordability of childcare, in particular for those that are providing the childcare. You know, John mentioned 1,600 childcare providers shut down. You know, even here in this county, you know, you're seeing hundreds of childcare providers shutting down. And so supporting the recovery of early childhood care providers, I think would be one thing. And also too around housing. I mean, we have got to figure out this affordable housing issue and how do we secure and increase funding for programs that can prevent homelessness. I mean, we've seen it and we don't know the answers. I mean, the answers is more housing, and we just have to figure out, you know, how do we make that happen?
Can you hear me?
Yes.
Okay, good. So I would add on to that, just with some numbers, and I'm glad, Donna, you mentioned this, is that, you know, childcare workers have never gotten any respect, right? and so their pay is abysmal. The average childcare teacher gets $14.21 an hour. And the fact is that childcare is really a public service. It's not a private market good. You know, what's the difference between, say, pre-kindergarten and kindergarten? Well, if you're in pre-kindergarten, your childcare teacher is getting about $14 an hour. And if you're in kindergarten, you have a professional teacher who is being paid decently for the work that they do. It makes no sense whatsoever if we are really concerned about childcare. Now, there's a lot of organizations and a lot of people who say, "Oh, this is bad, that we need to change this," but you know, they're not really stepping up to the problem. And the problem is there's not enough state revenue. And legislators will tell you, "Oh, that's really important, but we just don't have the revenue." That was before the pandemic, so now it will only be worse. So I have to say that whether it's childcare or health coverage for immigrant workers who are depending on, it really comes down to state revenue. And so that comes down to putting in place those revenue structures that will enable and in fact mandate that the wealthiest among us contribute to the commonwealth of our state. And that is, I think, the message that we need to get to the legislature is, come on, you can do this. It's important. We know there's popular support. You have to find the political will to put forward progressive tax structures.
Thank you. Erika, I wonder if you can, as a local funder here in Pierce County and one who has really stepped up to support the Pierce County Connected Fund and information sharing, what do you envision for long-term sustainable efforts rather than the immediate needs that we are responding to now?
Yeah, it's a great question. I think now as a community that we have this shared understanding, it's going to be so powerful. We had I'm thinking back to last week, we had a call where there's dozens of funders learning about the childcare issues and the complexities, and people hopped off that call with wow, we've been funding this issue for so long. We had no idea, what do we do next? And it's kind of, the conversation has shifted the shorthand that I've heard a lot is we can't buy our way out of this. And we like to come from a place of abundance, but that's true. We can't buy our way out of this. And the opportunity comes in the so then what? So then what do we do? What do we do as a community? What are we discussing? What are we advocating for? How are we pooling different resources that maybe aren't money? How are we pooling our expertise? And a lot of that's starting to happen already, even these early weeks as we're heading into kind of this out of the crisis and maybe into a little bit of stability phase.
Great, thank you. John, is there anything that you would add from a more statewide lens?
Well, I actually am a little more pessimistic about the potential recovery, because I think we're going to see the second wave of people who lose their jobs because of the decrease in consumption, the decrease in elective procedures in hospitals, et cetera. And so I think we won't be necessarily increasing unemployment significantly, but I think we're not going to climb out of it for a long time. I think we're going to be looking at this for a couple of years at least, of employment hovering between 15 and 20%, unemployment hovering between 15 and 20%. So then the question is, well, how do we build our Commonwealth and have some sort of economic security for the people of our state when we're in this sort of depressed economy, when we couldn't even do it when we were in an economy that was on fire in the past two years or past 4 or 5 years? And really, I may be sounding like a broken record, but we really need to take a really sharp look at how we build our state economy and fund public services. We can't depend upon philanthropy to fill in the holes if the holes are bigger than say potholes, if they're more like Mount St. Helens exploding. And so we really, and yet what's interesting is that we have the wealthiest people in the world who live in our state. We have the wealthiest corporations in our country. We should really figure out and take the steps to raise revenue from those people. We're one of 4 states out of 51 that, for example, we don't have an income tax. That's inexcusable. We should have an income tax on the wealthy. And there's other different mechanisms, but I think people understand what I'm saying. We need to have a rebalance of who is contributing to the revenue in our state, especially with part of this rebalance means that we're going to actually have a rebalance in the total economy between the private sector and the public sector. There will be more dependence upon the public sector for all sorts of services in the next 2, 3, 4, 5 years.
Absolutely. Don, I'm going to ask you this last question and then wrap us up. And thank you all again for sticking with us. Given United Way of Pierce County Center for Strong Families work, how has this crisis impacted the families living in poverty that were already in poverty, already impacted by so many barriers? And what kind of support, public and private, will there need to rebuild this area? You're muted, ma'am. Thanks.
That's a very good question, because we have 7 Centers for Strong Families in our network, and what I have found is that they are all pivoting to be able to provide services to their clients in different ways, because this is a very relationship-based model, and now having to do it virtually. In terms of the kinds of support that they're going to need, certainly United Way's support. My hope is that they have access to some of the stimulus dollars that are coming in to the county through the CARES Act. Many of them have already accessed the Pierce County Connected Fund as well. I think it's working with the centers are going to continue to work with the families, make sure that they're utilizing all the different supports that are out there for families right now. So I think that's the key thing, is helping those families navigate, what are the dollars that are available to them, if it's unemployment insurance, if it's getting access to food benefits and so forth. So that's, really at the heart of it, of the Center for Strong Family, is helping those families navigate through all of those various systems.
Certainly. And speaking of what families need, the Foundation for Tacoma Students, Tacoma Public Schools, and local internet provider Rainier Connect has partnered to increase access to technology for Tacoma students. In the wake of COVID, we have seen what it looks like disproportionately for students and young adults not to be able to access or connect, even virtually, with strong support systems, get the academic enrichment and supports that they need. We've already begun as an organization contacting families and have raised dollars, have received in-kinded technology and access to internet, and are beginning to distribute that as we speak. That is a great and huge order that the foundation has taken on. However, hundreds of families still lack access to internet and to technology. And as we think about what the future might be for education, it will be imperative for us to think about what supports we can offer to our families and our children as we go into that next year. We encourage you all to think about what you can do to support and give to close that gap for those families, and to support us as we are helping each one of them get prepared for this next year. Similarly, I wanted to just remind folks to visit the graduatetacoma.org/COVID-19 website. There we have been continuing to put up information as it evolves, particularly in the way of resources. For families that you all are working with, we encourage you to visit tacomalearns.org, where you can see where resources are available geographically and within your neighborhoods, and also to request for assistance and support as you need it, particularly around the needs for access to internet and to technology. This website is allowing for you to get what you need done quickly in a one-stop shop, be filtered through an application process, and you'll be able to hear from someone to help you navigate whether or not those needs can be fulfilled. Again, the gap has not been met. Hundreds of students still are without, and so if anyone is able to support and give, we certainly encourage it. Finally, I'd like to tease us up for next Friday's forum, and certainly send a thank you to my panelists. But next week, we'll be talking about mental health and what we do this summer. Little contact with our support systems, friends, family, teachers, and mentors are all looking to figure this out together. Fear of our financial stability and the physical well-being and the uncertainty of the future has so many of us struggling, including Tacoma youth. In this next session, we'll discuss with both the impacts of COVID-19 on mental health of young people and their families, and we'll consider how we can best meet their needs where they are starting this summer. You can always register by going to graduatetacoma.org/COVID-19, scrolling down and seeing which Friday forum is available. To that, and keeping on time, as always, thank you to our panelists, Dona, Erika, John. We appreciate you taking time, sharing with us what's happening. We appreciate all of your services. To everyone listening, stay safe, stay healthy, and enjoy your weekend.
Thank you.
Thank you.